Good morning, ma'am. This is my report. SAD Seasonal Affective Disorder. Seasonal affective disorder is a type of depression that related to changes in seasons. SAD begins and ends at about the same times every year. If you're like make people with SAD, your symptoms start in the fall and continue into the winter months, sapping your energy and making you feel moody. Less often, SAD causes depression in the spring or early summer. Next, dumako na naman tayo sa signs and symptoms of SAD. Fall and winter SAD. Oversleeping. Ito yung sobrahan natin ng ating pagtulog at maaring ito yung pagtaas ng ating timbang. Appetite changes, especially a craving for foods, high and carbohydrate. Ito naman yung nagbabago ang ganang kumain, lalo na ang pagnanasa sa mga pagkaing matataas sa carbohydrate. And weight gain, ito yung pagtaas ng timbang gaya na lang kung masobrahan ang pagtulog natin. And tiredness or low energy, ito yung makakaramdam tayo ng pagod sa bawat araw. Okay, dumapo naman tayo sa spring and summer SAD. Trouble sleeping, ito yung problema sa pagtulog dahil siguro sa ginagawa o iniisip tulad ng paggawa ng school activity. And poor appetite, ito naman yung walang ganang kumain or walang gana sa pagkain dahil sa mga iniisip natin. Weight loss, ito naman yung pagbaba ng ating timbang dahil sa di tayo nakakatulog or walang gana sa pagkain. And agitation or anxiety, ito naman yung pagkabalisa o kabigatan ng isang kaganapan o sitwasyon tulad ng pagka-depress. Halimbawa ay ang mga kaso ng mga nag-suicide. Seasonal changes in bipolar disorder. In some people with bipolar disorder, spring and summer can bring on symptoms of mania or a less intense form of mania, hypomania, and fall and winter can be a time of depression. Dumapo naman tayo sa treatment for SAD may include like therapy, photography, medications, and psychotherapy. Treatment can help prevent complications, especially if SAD is diagnosed and treated before symptoms get bad. Treatment for seasonal affective disorder may include like therapy. If you have bipolar disorder, tell your doctor this is critical to know when prescribing like therapy or antidepressant. Both treatment can potentially trigger a manic episode. This is my explanation to treatment. Ang treatment makakatulong para maiwasan ang mga complication katulad ng kalungkutan. Malalaman at mararamdaman ito bago makuha ang masamang mga sintomas. Psychotherapy is the use of psychological methods, particularly when based on regular personal interaction with adults, to help a person change behavior and overcome problems in desired ways. Example of psychotherapy, guidance counseling, kung saan they give advice to those students who's in trouble, bullied by their classmates. Psychotherapy, also called talk therapy, is another option to treat SAD. A type of psychotherapy known as cognitive behavioral therapy can help you identify and change negative thoughts and behavior that may be making you feel worse. Learn healthy ways to cope with SAD, especially with reducing avoidance behavior and scheduling activities. Learn how to manage stress. Dumako naman tayo sa psychotherapy can be helpful in treating most mental health problems. Anxiety disorders such as obsessive compulsive disorder, phobias, panic disorder, or post-traumatic stress disorder. Mood disorders such as depression or bipolar disorder, addiction such as alcoholism drug dependence, or compulsive gambling. Ang psychotherapy nakakatulong sa problema sa pag-iisip katulad ng anxiety, mood disorders, and addiction. Ito ang mga dahilan kung bakit magkakaroon tayo ng problema sa pag-iisip. So, dumako naman tayo sa types of psychotherapy. There are a number of effective types of psychotherapy. Some work better than others in treating certain disorder and condition. In many cases, therapists use a combination of techniques. Your therapist will consider your particular situation and references to determine which approach may be the best for you. So, meron ding types of psychotherapy yung mas mabilis na gumagana or mahusay kaysa sa iba sa paggamot ng ilang mga karamdaman at kondisyon. Sa maraming mga kaso, ang mga therapist ay gumagamit din ng mga kombinasyon o diskarte. Next, punta naman tayo sa types of psychotherapy. First, cognitive behavioral therapy, CBT, which help you identify unhealthy negative beliefs and behavior and replace them with healthy positive ones. So, ito ay naglalayong mapabuti ang kalusugan ng pag-iisip at nakatuon ang CBT sa hamon at pagbabago. Second, dialectical behavior therapy, a type of CBT that teaches behavior skills to help you handle stress, manage your emotions, and improve your relationships with others. Acceptance and commitment therapy, which help you become aware of and accept your true and feelings and commit to make changes, increasing your ability to cope with and adjust to situations. Ito ay isang psychotherapy na nakabatay sa ebidensya na nagsimula sa mga pagsisikap na gamutin ang borderline personality and disorder. Third, psychodynamic and psychoanalysis therapies, which focus on increasing your awareness of unconscious thoughts and behaviors, developing new insights into your motivations, and resolving conflict. Ito naman yung para sa pinakabahagi at gumagawa ng mga pagpapalagay tungkol sa kung paano gumagana ang isip. Types din to ng psychotherapy. Interpersonal psychotherapy, which focuses on addressing problems with your current relationship with other people to improve your interpersonal skills. So, ito naman ang nakatuon sa paglutas ng mga problema at pagbawi ng sintomas. And last, types of psychotherapy, supportive psychotherapy. Supportive psychotherapy, which reinforces your ability to cope with stress and difficult situations. Nagsasama ito ng mga sangkap mula sa mga therapeutic na paaralan tulad ng psychodynamic, nagbibigay malay na pag-uugali at interpersonal ng mga modelo. Dumako naman tayo sa psychotherapy can be helpful in treating most mental health problems. Anxiety disorders such as obsessive compulsive disorder, phobias, panic disorder, or post-traumatic stress disorder, mood disorders such as depression or bipolar disorder, addiction such as alcoholism, drug dependence, or compulsive gambling. Ang psychotherapy nakakatulong sa problema sa pag-iisip katulad ng anxiety, mood disorders, and addiction. Ito ang mga dahilan kung bakit magkakaroon tayo ng problema sa pag-iisip. Eating disorder such as anorexia or bulimia. Ito yung mga karamdaman sa pagkain tulad ng anorexia o bulimia. Mga karamdaman sa pagkatao ng borderline personality disorder. Personal disorders such as borderline personality disorder or dependent personality disorder, schizophrenia, or other disorders that cause detachment from reality. Next, psychotherapy can help with a number of life stresses and conflict that can affect anyone. For example, it may help you resolve conflicts with your partner or someone else in your life, relieve anxiety or stress due to work or other situation, cope with major life changes such as divorce, the death of a loved one, or the loss of a job. Learn to manage unhealthy reactions such as rude rains or passive-aggressive behavior. Come to terms with ongoing or serious physical health problems such as diabetes, cancer, or long-term. Recover from physical or sexual abuse or witnessing violence. Cope with sexual problems whether they due to a physical or psychological cause. Sleep better if you have trouble getting to sleep or staying asleep, insomnia. In some cases, psychotherapy can be as effective as medications such as antidepressant. However, depending on your specific situation, psychotherapy alone may not be enough to ease the symptoms of a mental health condition. You may also need medications or other treatment. Next, medications. Ito ang pag-diagnose, magpagaling ng mga sakit o maiwasan ang sakit. Some people with SAD benefit from antidepressant treatment, especially if symptoms are severe. An extended release version of the antidepressant bupropion may help prevent depressive episodes in people with a history of SAD. Other antidepressants also may commonly be used to treat SAD. Your doctor may recommend starting treatment with an antidepressant before your symptoms typically begin each year. He or she may also recommend that you continue to take the antidepressant beyond the time your symptoms normally go away. Keep in mind that it may take several weeks to notice full benefits from an antidepressant in addiction. You may have to try different medications before you find one what works well for you and has the fewest side effects. Next, self-care. Ito yung pag-alaga sa ating sarili para maiwasan ang mga sakit. Example of self-care: develop a regular sleep routine, take lunch breaks, aim for a healthy diet. Lifestyle and hope remedies. In addition to your treatment plan for seasonal affective disorder, make your environment sooner and brighter. Open blinds, strip tree branches that block sunlight, or add skylights to your home. Sit closer to bright windows while at home or in the office. Get outside, take a long walk, eat lunch at a nearby park, or simply sit on a bench and soak up the sun. Even on cold or cloudy days, other light can help, especially if you spend some time outside within 2 hours of getting up in the morning. Exercise regularly. Exercise and other types of physical activity help relieve stress and anxiety, both of which can increase SAD symptoms. Being more fit can make you feel better about yourself, which can flip your mood.